So it's my pleasure to speak to you today about how we treat cancer. And we just start by talking about the players. Oncologists are the doctors who treat cancer. They're supported by large healthcare teams. We have surgeons who operate on cancer, radiation doctors who give radiation, and we have medical oncologists who give drug treatment. It's really important to know what your goal is. In some patients, we're aiming for cure. That means we're completely eliminating the cancer. This usually involves major surgery, but we can also cure some patients with radiation and even some with drug. There are some patients where we're trying to prevent recurrence. After surgery, the cancer can sometimes come back. And if we use radiation and drug therapy, we can often prevent a recurrence. There are also patients where we know we can't cure or prevent, where our goal is to control the cancer. This is particularly those whose cancer has spread, and our goal with any of these treatments, surgery, radiation, or drugs, is to slow the cancer down, improve symptoms, and improve the quality of life. So how do we do this? Surgery is probably our most important tool in terms of cure. We've been using surgery probably for 4,000 or 5,000 years. Almost every patient has a biopsy, which is a sampling of the cancer. About 45% of patients have a surgery to try and cure their cancer. And sometimes if the cancer is spread, we'll use surgery to try and cut that out too. This is a colon cancer in the red circle there in the middle. And I'm just showing you that if we use surgery, we cut where those two blue arrows are, we can remove that piece of cancer and the lymph nodes and sometimes cure the patient. This picture is a CT scan, and you can see a liver in that blue triangle. And in the red circle is a metastasis. The cancer spread to the liver. And in this case, it was removed surgically, and the patient did well. We're now getting into these really fancy ways of doing surgery. There's even robotic surgery, where there's a machine that operates on the patient, controlled by the surgeon who's on the left there. So probably the perfect job for a star gamer. This is a slide of a patient of mine who decided to decorate his surgical scar and was quite proud to show that off to me. We also use radiation treatment a lot. About a quarter of patients have radiation. We use it to cure, to shrink cancer, make surgery easier, to prevent recurrence, and to help symptoms. Most radiation is delivered by what's called external beam, and here you can see a linear accelerator. It's a $5 million machine that shines a radiation beam on a patient. There's the couch the patient lies on. Here's the thing called a gantry that spins around the patient and shines radiation from multiple directions. And with this, we can sometimes cure cancers. Sometimes we'll implant radioactive seeds. So right here, you can see a bunch of gold seeds in a man's prostate, and they're slowly letting off radiation that helps get rid of the cancer. And finally, here's a bone scan. You can see a skeleton. You can see a lot of black dots, and those are cancer in the bones. And we can radiate those because they're often very painful, and radiation will help that. We do use drug treatment in about a third of patients. We've had drugs for about 70 years. Initially, we only really had hormonal drugs and chemotherapy, which can have a lot of side effects. Now, we're still using those drugs, but we're adding a lot of other things like targeted therapies, antibody therapies, immunotherapy, where we get the body to wake up the body's immune system so it'll fight the cancer, and something called precision medicine, where we try to target the mutation specific to a cancer. We can cure some cancers, lymphoma, leukemia, testicle cancer. Here's a patient of mine who had a big cancer in his chest. This is a CT scan. You can see in the circle a cancerous mass. After chemotherapy, it's shrunk to almost nothing, and the surgeon was able to cut it out for us. I'll show you one more slide of him at the end. We also use chemotherapy and drug therapy to prevent recurrence after a variety of cancers. And we use drugs to keep people living longer. So even with incurable cancer, sometimes treatments now will help them live 2 or 3 times longer than they used to. And there may even be some patients that we're curing now that we didn't before. Here's a chest and a CT scan showing tiny little nodules. These are all metastases, and made this patient quite symptomatic, and some chemotherapy helps shrink those and improve the situation. So we're using treatment for cancer of a variety of sorts. It's a rapidly evolving field. Surgery is becoming safer and less invasive. Radiotherapy is using new tools and new techniques. And there are all sorts of new types of drugs and new indications. So that I would come back to my patient. This is the body art that he chose to represent his cancer after he was all done treatment and was cured. So thanks for your attention, and it was a pleasure speaking to you today.